I'm so impressed that so many people have joined this session. I am so impressed, or John and I will be, because this whole event, meeting, came about because John and I met about a year ago, but more so in the last ePortfolio forum at La Trobe, and we said, oh, we must catch up, and with a view to compare notes. And I did manage to catch up to John at Monash, and I don't know, John, speaking for both of us, but we found it to be a fruitful meeting in the sense that we were sharing what we were doing and sharing ideas about why we're doing it and how we're doing it. And both of us learnt something from each other. And I think both of us felt that in our own institutions we do work in some isolation. In other words, we're the PebblePad people at our own institutions, and it was so refreshing to be able to talk to John and talk about PebblePad without explaining why. But John and I hit it off and said, let's continue these conversations. But we're both busy people, and physically being in the same space takes up a bit of time. And so we said, oh, let's try to meet online. And we spoke to Alison, or Alice, I can't remember how. Alison suggested, well, why don't we see if there are other people? And that's why we're all together today. And once again, I am so impressed that everyone is interested enough to join this session. Did you want to add anything, John?
Yeah, look, I think this proves an extraordinary opportunity to have a group of like-minded people get together and just basically try and better what we do, really. So I guess we promote open discussion and questions, and it's a brilliant opportunity to network as well as everything else. So another must catch up, all of us.
Yeah, and look, that's right. The focus about, well, today anyway, it's not so much about, oh, here's my case study, look at what I've been doing. It's more about using that as a vehicle to prompt discussion. We're keen on connecting with like-minded people using PebblePad, and in this particular case it's health. But it's about, well, that community of practice, being able to speak to each other, to share the good and bad, and to maybe help each other to problem solve and inspire each other to make the use of our PebblePad systems better for all and sundry. So what we'll be having is two presentations, one by myself and then John, and there'll be opportunity to ask questions at the end of it, if we have time at the end of our sessions. But we'll allow about roughly 20 minutes or so, 15-20 minutes, and at the end there'll be plenty of time to talk and discuss further. It's less about the presentations, it's more about building up this community and hopefully help each other out. Do you want to, anything else, John? Otherwise, I'll go straight into the presentation.
Yeah, go straight into it. I really think, look, this is what it's all about, that opportunity to tap into the community and learn from each other, really. So go for it.
All right, then. Okay, well, my session is very much about what we've been doing at La Trobe, in particular around about the clinical assessment using the fantastic PebblePad workbooks. And so I'll give you a flavour about what I've been doing here. Not a lot of detail, but some of the things that I've learned and some of the approaches that I've developed over the last few years. So, okay, let's just jump into it. Look, initially I started using the workbook functions with our postgraduate nurses, and that was in 2013. We had about 4 subjects using the same workbook, about 60 students, and I learnt a lot from that that initial pilot. And now we've rolled out further over it was well received, so much so that last year we had 12 subjects with 307 students using it, and this year there's even more. So many of you who are using PebblePad may be familiar with using paper clinical tools, and this is the rationale for moving away from paper. We have an opportunity to put this online, and this is what's been the big carrot for our staff to move away from paper and leverage the online functions in PebblePad workbooks. So you may be familiar with something like this. On paper, the students would self-appraise, and they would be assessed by a supervisor on a clinical placement. So we moved that from this paper form to the workbook functions, and we also had the opportunity to ask the students to provide evidence of in their self-appraisal, and I think this was a big turning point in a lot of ways. The students were asked to provide evidence if they claimed a certain level of competence, and it was successful. So much so that this unsolicited feedback from one of our lecturer practitioners, that she wrote to me, "I've seen a real shift in the attitude of the student group. They seem to be taking more responsibility for their own learning, identifying gaps, and making appropriate plans to develop." I fell off my seat when I saw this, because I thought, wow, this is really good. And this particular lecturer understood the value and promoted it and facilitated it appropriately with her students. But when you get feedback like this, I really think it makes me feel good. So from there, we started using it in a number of other subjects using their workbooks, and I started to use the same approach for each of the workbooks that I developed. And if anyone's familiar with software development, it's very similar. There are design, develop, implement, and review phases for a software development, and I use this development model when I speak with staff, and so they understand the different phases for developing their clinical tool. One of the key phases is implementation, is the training. So we train our students, our staff, and our external clinical educators. So I've sort of summarised what are the key points when I do training for the students. And if we're providing some orientational training to the students, we keep it very short and focus only on the tools that they're going to use. You all know that there's so many different functions and features in PebblePad that it can be overwhelming. So in the training, I only focus on the tools that they're going to use for the particular activity. And so in this particular case, I get them to find the workbook, use it, and submit it. Simple as that. No more, unless they ask further questions. So they have some online instructions as well. We provide those and a whole raft of how-to videos. And this year we've implemented some more orientation to PebblePad during the first week of semester. Similarly, with clinical educators, we make sure that the training is contextual and minimal, and look at no more than 30 minutes, because I find that if you give them too much, it's overwhelming. And these are the things that I focus on for clinical educators. You know, how do they log in through the email? I show and get them to find the workbooks, how to open them, and what they might need to do for assessment, and then to save it. And it's so simple. They all say, "Is that all?" And that's really reassuring to me, because all of them are anxious using new tools, especially if you've moved from paper to online. And so if I keep it really simple, most of them get it. One thing though, not all these people can attend the face-to-face training. So we must ensure that we have a repeat of the instructions and a video to help those who don't attend the training. And I'm quietly confident about how successful that is. Similarly, for academic staff, they need a bit more training, about 1 to 2 hours total over maybe 2 sessions. Covers the previous, but I'll also cover just managing the students and the externals, and get them to have a look at the reports. And once they start looking at the reports, they really love the ability to collate all the data and take action on that. So that's the 3 levels of training that I do. The other documented workflow I have, and I use this to explain to staff, because, well, a lot of you know that there can be lots of different things to do at different times, at different phases in any workbook development. And I found that I would write notes to myself about what to do when, and then it dawned on me that these notes would be valuable for staff as well, so they can conceptualize what needs to be done by when. And I'm starting to use this much more to provide frameworks and information to staff. So one of the things some of the things I'd like to talk about are what issues that we've had that must be addressed. Students submitted multiple copies of the same workbook into one workspace, and which is a real pain in the bum initially. And since then, there's been some changes to the system, and this is what you must ensure is the case. You must ensure the workbooks are set to single use only. That will stop the multiple copies being submitted. I think by default this is what they're set to. The other problem that I came across is clinical educators complain, I can't see my students' clinical tool. They're here on placement, I can't see them, and we'd spend a lot of time, wasted time, setting that up. So how do you solve that? Before the students go out on placement, they must submit their clinical tool, and this is critical that they do this. It'll alleviate a lot of pain later on. So I've also instructed our lecturers how to look at the reports on which students haven't submitted, and the function to send a message to them is really good. Large groups were cumbersome to manage, especially changing clinical clinical sets. So any of you, have you been using sets? Easy to use when you've got 20 or so students, but once you ramp that up to, say, 250 students, managing multiple sets of students at multiple clinical locations with multiple clinical educators, which can change, it can be challenging. So I've been instructing administrative staff how to manage the sets, and with these large groups, we use the import of groups using CSV or from a spreadsheet, and I encourage them to have a master spreadsheet and keep the master spreadsheet up to date, and then we can easily import them into Atlas. Staff found it cumbersome navigating individual workbooks to review evidence. This was really a problem when we had multiple campuses looking at the workbooks and the reports weren't useful for them. But once I showed them how to use the reports and drill down to particular students, they found that this was a real bonus. So what happens if I get run over a bus? A lot of this work is critical on me being available to support people, and I've learnt that we need to plan to hand over responsibility for these tools so that these tools, workspaces, subjects are scalable and sustainable beyond me. And this is something that I'm keen to improve, and I'm looking very seriously at how to make this happen. Not that I'd like to get run over by a bus. So just to finish up, this is our current usage in health science in the disciplines of social work, dietetics, nursing and midwifery. 33 subjects, about 2,700 students using it, and with an incredible number of 640 externals. So that's about 15 minutes, I think. And I'll leave it there. Maybe if there are some questions for a few minutes, then I'll hand over to John. Were there any questions?
Terry, thank you very much for that. That was excellent. And there were a few questions along the way that I'd like to go back to just because I didn't know the answers. And some people have responded, but there's some that I think would be useful to have your thoughts on as well. One by Pauline. She says that our nursing staff are complaining that students don't have mobile devices on placement. And so she's wondering whether others have any data or anecdotes around this particular issue. Now, Helen from ECU did say that in WA, the tertiary hospital doesn't allow mobile devices on shift, but students are asked to complete at lunch or after the shift. So I'm just wondering what experience you've had around this.
Oh, okay. Yeah, no, that's a very good question. I suppose it depends on what your expectation is of the student on site. And we've found that with the same scenario, the students aren't meant to be using their devices on site unless they're off shift. But most of the student input tends to be done off-site for some of the workbooks that we've been using. And it's more about the clinical assessment on-site by the clinical educators. And the clinical educators, they must have some access to Atlas on-site because the students are in their care there. But so the question about students, we've found that less of a problem. It's more about ensuring clinical educators have the access.
Okay, thanks, Terry. And if others want to follow up on that question, then feel free to write things in. John asks, and I think people might be interested, is whether you have any administrative support at all.
That's a very good point. Administrative support for helping to manage the workspaces. I'm imagining that's the question, because this is a challenge at the moment, especially at, dare I say it, at La Trobe. It's a challenge for some of this admin support. And that's a key point, that when we start ramping up these large workspaces with multiple sets, we've found that someone needs to maintain those sets, and I believe the administrative staff are in the best position to establish them, but potentially the clinic, the lecturers could maintain them. But it's important to have that admin support for large groups.
For sure. Thanks, Terry. Listen, Terry, I might give you a chance to read through that chat area and just note any things that you'd like to return to at the end, because I'd like to actually move over to John now, and then we can continue with questions after John's presentation, if that's okay.
Yeah,
so, everyone just please keep writing questions in the chat area, because there's lots of good conversation happening there. I'll certainly try to answer things as I'm going if I can, and if anyone else wants to contribute answers or, ideas, please do in that chat area. That'd be great. So, John, you're on.
Okay.
Terry, you need to stop sharing your screen.
Okay. Hang on a second. If I can, I'll stop sharing. Great.
Yeah, excellent.
Okay.
So, John,
Thank you, Terry.
can hand over to you.
All right. Great. Oh, now. Okay, is that good for everybody?
Yep, now it is. Perfect.
Okay, thank you, Terry. Very informative. Thanks a million. That's really good starting point. So thanks for putting the pressure on. All right, so John, I work at Monash University, and so look, a little bit of the why, sort of like Terry did, and then one particular how of where we use PebblePad in one instance. Okay, so we had some driving forces, and in a year group of now 80 students, we were printing over 200 pages of clinical placement workbooks per student per semester. Obviously incredibly environmentally unsound, doesn't fit with Monash University's green policy. Okay, there was a cost obviously associated with that of about $6,000 a year. We had always the restricted nature of printed books. Once they're printed, there's no going back. And if objectives changed and whatnot throughout the placement, it became difficult. There was always a danger of losing work. Assessments were ripped out of the clinical books and posted to us, and difficult to monitor in progress. The students had the workbooks out there and we didn't see them for the duration of their placements, and that difficult to see all their work in one place. One book would be put to the bottom of a heap at the end of semester. And also this one, the inefficiencies in corrections, just we were tearing pages out of workbooks and sending them to external correctors and that. So that was one of the forces. We set ourselves some targets, I guess, with what we wanted from our online, particularly the aggregation and display of radiographic images, which was something that was really lacking. We never saw examples almost of the students' own work. We also wanted a self-directed learning environment from the student's perspective. We found it was too task heavy, and that ability to access students' work in various locations. And we were also this longitudinal progression. We were just really keen to see it all at a glance, and we again did not have that at all. We also wanted this to heighten the awareness of professional attributes. We were kind of finding that students, they just didn't have easy access to even the the graduate attributes of Monash University. Now we just embed them in the workbook, and the students write a bio, and this is one of the sort of targets from their perspective, and so it increases their employability, we felt, with having that already underpinning their targets. In terms of developments, look, we just went 360 feedback from IT, e-learning, students, externals, our university staff, liaison officers, and so on, through surveys, focus groups. And that, again, is the beauty of this, is the immediacy of the editing, given the feedback that we get. All right? And initially, we had seen PebblePad as just a platform to support the clinical placement learning, but we very quickly identified the potential for its use in the lab, given that students create images there, which again we were not able to see at all. So it led to just the students getting very little formative feedback on the weekly critiques they performed on their images. And then, yeah, the written critiques, if they were being looked at, they were being looked at entirely in isolation with no image to support what we would do in terms of feedback. And then they were left with their preparation for their hurdle image critiques. It just wasn't very well supported. So we had a fix, which was PebblePad. So like that, so we decided to take this on and decide how we could utilize this in the lab. So last year, about 7 months ago, we decided to give it a go, and we did a 3-week sort of a pilot. And this is how we set it up, by an adaptive release, so that after week 1, we would just set the next week's task, basically, with, as you can see here, the instructions and the objectives and the task here weekly. And this part, I think, is part, like, it seems to be a lot of people's favorite thing about PebblePad, the ability to supply the students with a template which they can collect. Brilliant for their guided reflection. Particularly, these guys were first years, where the template was just extraordinarily useful. And this was the template. They now knew what were the important aspects to be recorded on the template when they're doing their generating their image. My favorite thing about PebblePad certainly is the active collection. Sorry, it's not just showing incredibly well here, but I love this. You can provide the students with a template, tag it, cascade the tag to the students, and when they take apply criteria, it aggregates all of their completed templates. And I just find this extraordinary. I love it. We use it just so many times. So with all that set up, this is how it looked in our resource center, with the lab workbook, the templates for each week's reflection created separately. So we pinned down different aspects of the image analysis each week. And then standout achievement for us, certainly in the lab setting and beyond, in the clinical environment as well. I guess we were never seeing examples of the students' work, which was terribly frustrating. And partly it was the cost. They couldn't print films. They were not being allowed to print films in their clinical centres because of the expense. Whereas here with the digital image, it's free, basically. They put it on their USB once it's de-identified, and they're able to upload their image, which can support their image critique and their discussion, which now we have this fantastic alignment that we're not taking what the student said in isolation from an actual entity. And our results, like, simply, this is it. The students now, this is their image upload and discussion. So we can correlate that with an actual high quality image that they've generated, and we can ensure that, yeah, they're discussing it appropriately and not making any assumptions. And so that's been really, really, as I said, the standout achievement has been image collection. As radiographers, we're all about generating an image, and we were never seeing any, so it was really fantastic. And then we were also cognizant of this, if I revert back to that slide, about supporting the students with a formative learning. but with 80 students in the lab, something we had not done before, we were now fearful of this is going to be an absolute enormous ask for the academic staff. So again, we used this adaptive release to coincide with the week 1 lab. They actually got a feedback, which was basically a self-directed teaching tool. The students, we almost did a copy and paste from our texts, our prescribed texts, and populated these feedback fields after the student had done their image critique. And we told them it sits there for you at the end of your week, and you can basically do what you like with it. Did you do these things in your image analysis as well? And we found that it was well received, and the students appreciated it, and like that we felt a little better. And this is partly why I'm here today, is getting feedback on these aspects. Is this pedagogically sound, etc., etc. But we found this is the formative one, and we would still do a summative image critique formal assignment as well to support this. It was also able to like sort of bolster our debate with students. So these 2 readings that you can see at the bottom are they're kind of crucial readings to get right. But these readings, we can only adjudge their level of correctness, if you like, if we know all of these things, which was fantastic, because I had one student, for example, who had a DAP reading, which is basically the sort of exposure that a person might get if it was the real world, and it did not make any sense to me. I said, it's way too low, like that it can't be right. And I was able to actually go back to our lab and recreate exactly what they did by applying all of these values. And I came up with a different value, and I was able to get that student in the spirit, obviously, of good feedback and so on, and say, I have done your exact experiment, your DAP reading is incorrect, and we were able to recreate the task. So that was last year, and again we felt it went well, so we decided to take it a little step further this year, and we're going to try this, go live, okay, so everybody can see that, right? So I'm in now our current setup, and I've logged in as a student, and we load everything. This has been also a revelation from our perspective, the task list. If anybody uses that, it's been fantastic. Just the students were, a big complaint from the students was their assets store was getting populated very, very quickly. So now they go directly to their workbooks, and they can do everything within the workbook, which is really something, it's really brilliant. So this year, this is what we've taken on board. So as you can see, instead of 3 weeks, we now have 7 weeks of activities. The week 1 we've just done last week. We can provide the students with so many resources at their fingertips. We're able to give them a 300-page manual for them to just get a shock when they see the size of it, and they can do their tasks in here, describe the function of the icon and so on. We can embed URLs to other teaching resources that we use. And we can, and I'll go to the week 2 actually, image critique. We can, this is for their formal critique, we can provide them with a very high quality image, and they can basically, we give them the underlying parameters that they would need to perform a genuine proper critique. We give them their image analysis guide, again a template, again, load their image, and again this guided directions for at this stage their first years, and this will drop off as the years go on, but they draw their conclusion whether the image is acceptable or acceptable. So they're getting to do a very in-depth image critique through this. And as I said, the image has been the standout achievement. It's been really quite fantastic to see all the students' work. So we're quite pleased. And let me go back to this And that's it from me. As I said, I'm really excited now to maybe take some questions and so on. So.
Thank you very much, John. That's terrific. And I have to say to everybody, John and his team have only been working with PebblePad for a bit over a year now, and they have done amazing things in a very short period of time. And we're very brave because they started working with workbooks across a number of year levels right from the beginning and really just did everything at once. And a lot of that work is very much down to John. So it's really great to hear you talk about it, John, and to see some of the great things that you're doing and some of the features that you're using that other people are obviously through the chat not even aware of. So thank you very much for that.
Yeah, thanks, Alison. Yeah,
in terms of,
yeah.
John, would you like to just explain the task option a bit? I mean, I could do it, but I think it's better coming from you, seeing as you use it. Some others are not familiar with that task list option. So do you want to just say a little bit about that?
Yeah, absolutely. Yeah, we caught wind of the task option, I would say, about 5 months ago. And it's, I think it has to be activated for your site, Alison, as far as I'm aware. So you certainly did it for us. And you can basically preload
that's correct.
workbooks, and only workbooks, not single page things, into the workspace for the student. You have to tick them. Maybe I should have shown that maybe, but you have to tick them off as single use and show in task list. And so now the students can go in just like what I did, go to view tasks, and the workbooks are there, and it has been absolutely amazing, very well received. Students were they were actually finding, and I find that myself from the creator's perspective, is the file management is very different, and students were finding their asset store was very full very quickly, and if they've not tagged them appropriately, they were finding it difficult to find them. So that has been brilliant, yeah.
Thanks for that, John. I'm just seeing there was a lot of conversation going on while you were talking. And I'm just seeing whether there are any questions that were left unanswered. Terry, I don't know if you want to jump in at this point with any things that you picked up out of the chat area during John's talk too. Please feel free to jump in too.
Only just to reiterate what Shane's popped on the chat there. The Shane's telling us that there's a task list as a precursor to the need-to-do list for the Pebble dashboard that we'll hear about in May. So I'm very interested in that, Shane. But no, that was great. Obviously, there's a lot of interest in the task there. And I didn't realise that it hadn't been activated. Is that something administrators do, or is that something you do, Alison?
Yeah, you need to let me know. It's something that our team does for you, so it actually gets switched on for your install. And I don't know if Shane might want to come in here, but the reason why it wasn't sort of turned on for everybody to start off with is that it was actually really designed for people who are using PebblePad for a very defined purpose, where they're really only using one workbook, and they didn't want their students to have to go hunting through an asset store to find this one workbook. And so we've built up this task list. Now, one of the things you have to be really mindful of is that if you've got a student who is involved in 4 units that are all using PebblePad, and everyone starts putting all the workbooks in the task list, your task list is very quickly going to become as confusing as your asset store. So there needs to be some consideration around how that is used so that the task list is actually still beneficial and not actually, that doesn't end up having some of the same difficulties as your asset store, because you can't search the task list, for example. It is just a list. So if they have a huge list, then it becomes difficult. I hope that makes sense.
Yeah, it suited our purposes very well because our students were going on a clinical placement for the 6 to 8 weeks, and we are using only workbooks, and they have probably about 4 workbooks at a time, and they're only enrolled in, we're the only unit to use it across the course. So